Hi everyone. In this video, I'm going to demonstrate a stretch for the upper trap muscles or your shoulder muscles here. So to perform this exercise, it's fairly simple. If you want to stretch your right side, I want you to try and bring your right hand gently behind the body, just like that, right? And now, trying to look straight, I want you to get into a slight chin tucked in position, and now trying to touch your left ear to your shoulder, and then you should feel a gentle stretch all along that muscle here. Again, I don't want to be too aggressive with it, and I definitely don't do this if I have a lot of pain. So if my patients come in and they are really hurting and their muscles are really angry and tight, I'm not stretching those muscles right away. So I want you to remember this. If you're working from home and you feel a little stiffness or a little discomfort, then it's okay to do the stretch here. But if you find that you have a lot of pain around that area, that's probably the muscle telling you that it wants to be left alone. So when a muscle is really hurting, you don't want to stretch it too much. Now, just to progress a little bit on this, so you're trying to do your stretches here and you're getting better and better with your side motions. You can also use the opposite arm to gently tug on the head to add a bit on that stretch there and back. And generally I like to hold this anywhere between 10 to 30 seconds. Give it a shot. In this video, I'm going to demonstrate a pec stretch. Because we're working from home, sitting on our computers all day, we tend to work with that bad posture where our shoulders are going to roll forward and we're hunched over from our mid-back. Now, we've already discussed what we can do for our mid-back using a foam roller or some of the mobility drills that we practiced on the desk. But apart from being rounded at the back, the other compensation that happens from sitting is just tightness around your pec muscles or your chest muscles. So your shoulders are rolled forward, and then you're typing away on your computer. Sitting in this position for too long can just tighten these muscles out. So stretch for that at home is a simple doorway stretch. What I'd like you to do for that is find a doorway. Hopefully that's not too wide. This is a bit wide for me, but it still works. But a little narrower is better. And your starting position would be elbows placed at the door frame there and at the level of your shoulders. So your arms are parallel to the floor. And then I want you to take a big step forward and lunge into that. And you should feel a good stretch across the chest muscles. And then I want you to hold that stretch for anywhere between 10 to 30 seconds and ease into it. You don't want to be too aggressive. You don't want to be pushing too hard into that, right? Also, I want you to be a little cognizant about your neck posture. So when you get into a stretch, I don't want your neck going forward like that, right? We're trying to correct that. So in this, always trying to keep that chin tucked in, neutral neck posture, and holding that stretch for, again, 10 to 30 seconds. I sometimes play around with this. I'll also, once I get really comfortable with this stretch, I start moving my arms up. So just moving your arms further up a little bit here. Again, that's why you need a narrower door frame. But then stretching through here gets the lower part of your pecs, a little bit of your lats, and some triceps as well. So again, you can play around with that angle a little bit. But to begin with, just start at about 90 degrees or at the level of your shoulder. And again, lunge forward. Give it a shot. So if you do feel some stiffness or pain around your upper trap, shoulder, neck region, or your mid-back between the shoulder blade region, I just want to show you some home hacks that you can use that might help you alleviate some of those symptoms. For this, all you need is a tennis ball, really. And before I demonstrate the exercise, I just want to show you what exact area I'd like you to work on. If you have more pain, like say around here, that's fairly simple. You use the tennis ball and squeeze that between your upper trap region or your shoulder region and the wall, and then squeeze that ball between your shoulder and the wall. If you find a sore, kind of knotted up, scrunchy spot, I just want you to work on that. So just moving your body side to side, but keep the ball on that tender spot for about a minute or two. And I definitely want to say that you don't want to be too aggressive with this. So a little bit of gentle push can cause some discomfort there. And when you're doing this exercise, your discomfort shouldn't be more than say a 3 or 4 out of 10 on a discomfort scale. So if you find yourself digging too hard and you have an 8 or 10 discomfort, you might end up being more sore at the end of this exercise. So again, take the ball and try to work all along this spot right here, which is your upper trap shoulder region, and then same thing on this side here. So just working on either sides, releasing that area. Now, if your pain or discomfort is more towards the mid back or around the shoulder blade region, I just want to show you the areas I just like to show you the areas you'd like to target. So here's a model of the spine, and this is the view from the back side. So you can look at the vertebrae here, which is basically the spine running down here. This is your cervical spine or the neck, and this is your mid back starting here, right? We have a bunch of muscles on either side of the spine. So we have the shoulder blade kind of sitting right here on the side, on either sides, and then you have a bunch of muscles that run in between the space between the shoulder blade and the spine here. So you want to get that ball not exactly on the spine or the neck here, but definitely in between that spot, and then just kind of work on rolling that ball over the area. If you find a sore spot, just work on that for a minute or two. Again, always following that principle of not being too aggressive with this. I just want you to be careful when you use this ball too further up the neck, like at the base of the head. You want to avoid this spot just because we have some really important blood vessels running through that area, and you don't want to compress that too much. So avoid using the ball right up here or right around here too aggressively, but then you can definitely start working a little further down on either side of the spine. So you could start here. So I'm going to put this away and I'll just show you how to perform that. So same thing like before, you get that ball, you sandwich that between your body and the wall, hopefully not on the spine, but in between that space that I just showed you. And then what I'm doing here is I'm doing like mini squats. So I'm kind of running along the length of the spine on my right side here. And again, you find a sore spot, you could also go side to side, just work on that for about a minute or two. And then you could also move it along a little up higher, like right around there, right? And then work on that spot again. Again, side to side, or you could squat back and forth. And you might have to play around with this and tweak it a little bit. So maybe sometimes you might have to turn to the side to get the right spot. There, right? And same thing on the other side. So just finding that sore spot and working on it for a minute or two. There. Give it a shot. So if you're stuck working at home and you do have an access to a foam roller, this next exercise is one of my favorites to address stiffness and mobility problems around your mid-back region. So this is the next progression to the seated mid-back extension, which I showed you before this. So if you've never done this before, the first time you do it, it can be fairly aggressive. So I want you to try that first, just to loosen up the mid-back a little bit. And after that, hopefully when the back is a little looser and you have built up some tolerance to moving your back in those positions, I want you to now progress on to the foam rolling exercise. To perform this exercise, I want you to place the foam roller around your mid-back shoulder blade region, right? So your hips and knees are bent at about a 90-degree angle. You use your hands with your fingers interlocked under your head just to support your neck a little bit. And then all we're going to try and do is we're just going to roll that foam roller around the shoulder blade region and just work up and down at the area of the mid-back. So getting the hips off and then supporting your neck with your hand. I want you to use your legs to push yourself up and down, all the way from the top of your shoulders up until the end of your shoulder blade region, making sure you're never doing this at the lower back. The lower back can be fairly sore if you do this. So again, just addressing that area, going back and forth. Again, sometimes it can be really aggressive, so I only want you to start with a few seconds and then get the bums down, relax a little bit, and then repeat it. Start with 10 to 30 seconds and slowly build up your tolerance to this exercise. So one more time, hands behind your head, get the bums up, and then you're just kind of sliding back and forth with this. Now, as you get comfortable with this, another way to perform some extension or open up the mid-back is getting your bums down, and then all you're trying to do is just pushing the head back towards the floor and pushing your mid-back into extension. I like to do this with breathing, so I'll take a deep breath in, and as I exhale, I'm going to try and drop my hands and my head further closer to the floor, and then again, same thing, inhale, and as you exhale, slowly drop your heads down a little further. Again, this can be really aggressive, so follow that sequencing that I showed you where you start with the chair first and then slowly progress to just kind of rolling on this, and then eventually start bending backward over on the foam roller. Give it a shot. So this next exercise is going to be a variation of the child's pose exercise, with the difference that I'm going to use the foam roller under my hands, and it just helps me slide a little better, and also allows me to drop my chest further down. Again, just trying to mobilize that area. So starting position is just like the child's pose. You're all fours. I want you to try and put both your hands on the foam roller here, and then widen the space so that you can lower your hips between your legs, and now use the foam roller to slide forward and drop your head and your chest down towards the floor as far as you can go comfortably, and then slowly coming back up again. So again, you could probably just do repetitions with this where you're just going into the stretch and out, or you could hold that for anywhere between 10 to 30 seconds. And this is a great exercise to, again, not just stretch your mid-back region, but a little bit of your triceps and your lats here. Give it a shot.